But first tonight, the Perth mums who say they could ease the pressure on our public hospitals by treating thousands of patients in their own homes. But as Cy and Doherty reports, they're being met by brick walls.
We don't understand why the government hasn't embraced this concept.
I think for the majority of patients, being treated at home is a better option.
It's stress-free and so easy and it's safe.
When Patricia Griffiths was told she had cancer, the one saving grace was that she could receive her treatment at home.
OK, Patricia, I'm just going to put the line in your arm now.
Right,
okay?
yeah.
Despite the convenience and cheaper costs of delivering chemo at home, it's got little support from health bodies.
We don't know why they won't, but they've just said no.
Lorna Rogers and Julie Wilkes co-founded Chemo at Home 2 years ago.
We go to the patient's home and do their chemotherapy almost exactly the same as they would have if they went to a hospital to have their treatment.
According to the former health department employees, home chemo is better for the patient and cheaper for the government.
It costs 50% less to treat patients at home than it does to treat them in hospital.
Julie knows the benefits firsthand. She ran a government-funded home chemo service for more than a decade.
Patients report that they feel more empowered when they're treated at home and they feel more knowledgeable about their treatment when they're treated at home as well.
But right now, chemo at home is a luxury not everyone can afford.
At the moment, we only can do this for privately insured patients or patients who wish to pay for it privately.
The business partners say they're often called upon by public patients, but their hands are tied.
We can't help them because we don't have a contract with the government to service public patients.
Which means many patients in the south will miss out. Despite recent reports, Fiona Stanley Hospital's oncology unit is overloaded.
They're working at about 160% of their capacity. So we know many of the people that work at Fiona Stanley and they're struggling. The staff are working incredibly hard to get through the patients.
The South Metropolitan Health Service, which oversees the district, says the need for chemo at home hasn't been substantiated and wouldn't be safe for all patients. And they say the problems at Fiona Stanley are short-term.
We can provide a solution to them immediately to help some of those patients and give the patients a better experience and help reduce the stress on the staff at the hospital.
Lorna and Julie can't understand why they're being met with resistance given their training in treating cancer.
If you're at home and something goes wrong, you've got a trained nurse who has backup equipment and backup drugs. And, you know, it's exactly the same.
They're now lobbying politicians to give them a chance, so those who have cancer have a choice.
The public patients are some of the ones who would benefit most. They're sometimes the ones who have less support and less travel options. And certainly, from my previous experience, they would benefit very much from being able to be treated at home.
I just hope that the government will get their collective finger out and, or as Prince Philip would say, extract the digit and really see that this service is available to the public patient.